Hey, gorgeous. Welcome to Season 3 of the Hormone Puzzle Podcast. I'm your host, Coach Kayla Smith, CEO of the Hormone Puzzle Society, a women's health hub for fertility, hormones, and pregnancy, an integrative, holistic nutritionist, doctor of natural medicine and training, creator of the Hormone Puzzle Method, an infertility warrior, two-time boy mom, and women's health expert. This podcast is for women struggling with infertility, painful periods, terrible PMS, or really just any symptoms of hormone imbalance that they are ready to eliminate for good. Tune in weekly as we interview amazing experts in the field of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally help you put those pieces of your hormone puzzle back together so that you can get pregnant and eliminate those pesky symptoms for good. Not to mention, stay pregnant, have a healthy super baby, and easy postpartum. Are you ready? This season is packed with even more expert guests, sharing groundbreaking knowledge, giving you that jolt of energy that you so desperately need, sending you lots of virtual hugs, and inspiring you to take your fertility into your own hands and make that baby. Thank you all so much for tuning in and being amazing listeners. So now let's get started on your road to transformation. On today's show, we have Dr. Sasha Hakman. She is an OBGYN and fertility specialist. She completed her OBGYN residency training at Michigan State University, Providence, and did fellowship training in the reproductive endocrinology at the Medical College of Georgia, where some of the pioneers of our field were trained. Fun fact, this is where Clomid for ovulation induction was discovered. She is also a big fan of weight training and planning to work towards competitive bodybuilding postpartum. I love focusing on nutrition and exercise, is what she says, to improve overall health and fertility outcomes. She has a personal history with PCOS, and all of her knowledge and lifestyle philosophy has helped improve her symptoms significantly. She is on a mission to help other women, particularly those with PCOS, do the same. Today, we're talking all about exercise and fertility. Can you do it? How much can you do it? And what are some fun ways to incorporate movement into your everyday life? Now, let's welcome Dr. Sasha to the show. Hey, Dr. Sasha, welcome to the show.
Hey, thanks for having me.
Yeah, I'm so excited to talk about exercise today. This is one I get a lot, so this will be fun.
My favorite topic of all time.
Yes, I love it. So tell us a little more. Tell us about you and how you started in this field of women's health and with exercise and PCOS and all of it.
Great question. Actually, when I was a medical student, I really wanted to be a surgeon. And OBGYN was not even on my radar at all. But then when I rotated through it, I said, oh my God, I get to operate and treat women and be part of really, really key milestones in their lives. This is amazing. This is what I want to do. And then when I got into residency and was kind of deep into my training by my second year, a lot of people kind of planted the seed that I really had the personality of a fertility specialist, my attention to detail, my interest in research. I love innovative things. And so that's kind of what got me to the field of infertility. This entire time, not knowing that I had PCOS, I had been on birth control pills for so many years. And every time I tried to stop it, I just would never have a period. And so I had this crazy paranoia that I had diminished ovarian reserve. I was running out of eggs. And this is where I started to do all the testing and finally found out that I've kind of been treating my PCOS with birth control pills, but didn't really even know that I had that problem for so long. And this is where I kind of transitioned to wanting to eat healthier, exercise more, and had a complete change in philosophy in my lifestyle.
Oh, I love that. I love that. And it's so funny you say that about not wanting to be an OBGYN in the beginning. So many people I have on this show that are OBGYNs told me that. And I'm like, I guess you just fall in love with it once you start practicing it.
Totally.
Amazing. Amazing. So we're going to talk about exercise today. Why is exercise so important?
Oh my God, so many reasons. The list goes on and on. I mean, for starters, obviously your overall health and longevity. We know that exercise can help improve your mental state. So if you have any mental health issues or you're stressed, you need an outlet, exercise can certainly help improve that. It helps to improve your overall confidence, of course, your strength, depending on what type of exercise you're performing. But for many women, if you're dealing with difficulty losing weight, if you have PCOS or ovulatory issues with your fertility, we do know that exercise can significantly help to improve that for a number of reasons. By increasing your muscle mass, which we call your lean mass, you're decreasing your circulating testosterone levels. You may actually help improve insulin sensitivity. And for a lot of women where that is the root cause of their infertility and their ovulatory issues, we do see improved ovulation, sometimes to the point where they no longer even need other treatments. So for women, especially who are overweight, even fat loss of 5 to 10% of their overall body weight can significantly improve their fertility.
Amazing. I love it. So how much should we be exercising? You know, this is a question I get a lot. And I think it was one of my issues with fertility. I was exercising too much. And so, you know, how much should we be exercising? Is there like a standard?
There is a minimum recommendation, which is 150 minutes a week of a combination of resistance training with some cardio. And a lot of people don't realize that actually going on a power walk does count as cardio. And so if someone is really not into running, they don't feel like feeling out of breath or winded when they're exercising, going for a power walk can make a huge difference, and it increases the amount of calories you're burning in a day. It keeps you active, and it helps with all those benefits. But it really does have to be a combination of that with resistance training, not just cardio alone, and not just resistance training alone. So that 150 minutes is the minimum recommendation. There isn't like a maximum of, you know, a limit of how much you should be exercising. That being said, we do know that women with a lower BMI who tend to be more lean at baseline, they are more sensitive to having fertility issues when over exercising, and it's a matter of energy balance. If there's too much energy going out as opposed to what's coming in, then your body is kind of thinking, well, I guess I'm too stressed right now. I'm not in a place where I could be having a baby. There's not enough calories coming in. There's too much going out. And so a combination of that, and we know that also high levels of endorphins from so much exercise can actually impact the communication for ovulation between the brain and the ovaries.
For sure. And I think that was my issue. I was already pretty lean. I was a personal trainer. Yeah. So just more exercise on top of being lean was what threw my hormones out of balance. So
Totally. Yeah.
Definitely relate. And so can we work out during fertility treatments? What does that look like?
Absolutely, you can. I know that a lot of physicians, a lot of my colleagues will even say to stop exercising. There's also this fear that if you're going through IVF during ovarian stimulation, your ovaries are enlarged. And so there's a concern for possible ovarian torsion. That's where the ovary will twist on itself and cut its own blood supply. And that could be a surgical emergency, and in really rare cases, cause you to lose an ovary or even both in extreme cases. That being said, most of the time, ovarian torsions will happen in your sleep. It's not during exercise. And so, you know, sometimes I will tell patients to limit jumping and going upside down on a handstand, doing crazy yoga moves, but you can certainly still exercise. You just need to modify a little bit. So resistance training, if you're doing isolated movements such as leg press, bicep curls, tricep extensions, that is totally fine. And you don't have to worry about things when you do that. running might be a little bit too high impact if you're deep into your stimulation and your ovaries are super enlarged, but going for a brisk walk is definitely okay and can be even beneficial. And then the other time is during embryo transfers. I get that asked a lot, and I just tell patients to keep doing whatever they were doing before.
Right. I love that. Yeah. I worked out until I was 38 weeks pregnant, and I was on the spin bike saying like, this baby's coming on this bike. I just know it. So yeah.
Good for you. I mean, yeah, there's no evidence to show that you can't work out at the time of an embryo transfer. And I think that culturally, we all tend to look at the female body as this super fragile thing that cannot handle anything. And that if you exercise during an IUI, if you exercise after an embryo transfer, that you're just going to somehow terminate any possible pregnancy from occurring. But the reality is lots of women who don't go through fertility treatments and get pregnant on their own are continuing to exercise the same way they were before. And like you said, all the way up until delivery. So,
right. Yep, for sure. And so what about, during pregnancy, it's good to exercise still, and kind of like what I did?
Totally. I mean, you're maintaining good muscle tone. That can be super beneficial if you're having a vaginal delivery for pushing the baby out. I mean, we really underestimate the amount of effort it takes to be able to push. And if you have a strong pelvic floor and strong muscles, you're able to do that much easier than someone who never exercises, not to mention the stamina that is required. In addition to that, a lot of your ligaments start to get really loose. You have more pronounced what we call lordosis of your back. And so a lot of women will have lower back pain. But if you have strong muscles, especially in your core, you're going to have less problems with that. In addition to that, when you're exercising, prior to pregnancy and during pregnancy, you are reducing your risk of gestational diabetes, gestational hypertension. And so overall, pregnancy-related complications are diminished.
I love that. And I used to say I'm training for like the best marathon of my life, which is my labor. And yes. I pushed that baby out with no epidural and about 2 pushes. And my doctor was like,
that's amazing.
So wow. Yep. So it definitely works to have that pelvic floor working, with you instead of against you. I love it.
Exactly. Absolutely.
So I get this question a lot around cycle optimizing, cycle syncing. So have you really dove into that? Do you recommend cycle optimizing or syncing your exercise?
I don't. I just say, I think that we tend to overthink things a lot. I know that our hormones definitely fluctuate in a natural cycle. If you think about the menstrual cycle, the first half of it is estrogen dominant because you have a growing follicle with an egg that's producing lots of estrogen. And you also have higher testosterone levels. After ovulation, it's mostly about the progesterone. That's where your progesterone levels go up. And so there may be some changes in your energy level, and, how well or how optimally you can perform in the gym. However, I just say, just go with what you're normally doing. There should be no difference throughout your cycle of how well or how much you can exercise. The differences are probably so minuscule that it's not really significant. If I speak for myself, even as I was exercising during ovulation induction treatments, because really that's the only time I ovulate. And so those are the only times I really feel the effects of a natural cycle and the fluctuations in your hormone levels. But I honestly felt no difference personally. And when I looked into the research for this, because I have gotten this question a few times, I didn't really find anything substantial that was really significant to show that you should modify how you exercise throughout the menstrual cycle.
Gotcha. And, I'm a big fan, and we talk about this a lot on the show, of just listening to your body, like intuitively exercise. If you have the energy and you want to do a harder class, then do it. If you don't, it's okay to just walk that day. Like you said,
absolutely
power walk. So it's all about listening to that body and working out accordingly.
Absolutely.
Yeah. I love it. Well, we're going to take a short break. We're going to hear a word from our sponsors. We're going to come back in. We're going to talk about what we can do to optimize our fertility and hormones. So we'll do that and more when we come back. Hey y'all, it's Coach Kayla here. I hope you are loving this episode as much as I am. We will be back in just a minute, but first, a word from our sponsors. This episode is brought to you by the Hormone P.U.Z.Z.L.E Society, a women's health hub for fertility, hormones, and the business of coaching. Whether you're struggling to get pregnant with pesky hormone symptoms, or you're working to build a career in the fertility and women's health space, we have you covered. Visit our website at www.coachkayla.com to learn more on how we can help you. Text the keyword fertility to 615-257-8855 for your free fertility meal plan. Hey, Dr. Sasha, welcome back.
Hey, it's good to be back.
Yes. Let's talk practical tips. What are maybe your top 5 things that you recommend your clients do to really optimize that fertility and hormones?
All right. So I would say, aside from the obvious of lifestyle intervention, which is healthy nutrition and exercise, although I feel like I should go into nutrition a little bit more, that would encompass lots of plants. So I would say focus on your veggies. That should be the star of the show. Plant-based proteins are phenomenal, but also fish has been shown to be super, super helpful. I personally don't eat too much animal products, but I like to take away from my personal preferences and not be biased and go with what the research shows. And what we do know is having a few servings of fish a week can certainly help with that egg quality and improve fertility outcomes. And this has been studied through some really large prospective studies, mostly from Harvard. So we know that that is fantastic. Minimizing red meats has been shown to be helpful as well. And dairy still remains pretty controversial. I think that for the endometriosis patients, steering away from dairy may be beneficial, but for the average person, it's probably fine. Some studies have shown that dairy can be harmful. Other studies have shown that dairy is actually very helpful. So I say when it's controversial like that, just be somewhere in the middle, where if you like dairy and you can tolerate it, within moderation. So aside from diet and exercise, supplements have been shown to really improve egg quality, especially for those who are affected by infertility. My top favorite supplements, aside from, of course, folic acid, every reproductive aged woman should be on at least 400 micrograms of folic acid, but ideally 800. But also CoQ10 is a fantastic supplement. It's a powerful antioxidant and has been shown to improve egg quality. Ideally, it would be in the formulation of ubiquinol, since that is better for accessing the follicular fluid to actually nourish the egg. Additionally, for many women, if you have PCOS, then myo-inositol and dechiroinositol is where it's at. You want it at a 40-to-1 ratio. If you look at the bottle, that's what it should show. Additionally, melatonin has actually been shown to be helpful for egg quality as well. And plus, it's great to take at night to help you sleep. For most people anyway. I know some women have told me that it keeps them really alert and awake, which is wild to me, but everyone's different. And additionally, the last one is N-acetylcysteine, a big fan of NAC for egg quality. So those are the big supplements for women. In addition to that, I know that there's always this controversy of stress and how that can cause infertility. The reality is mild stress is probably not impacting your fertility journey at all. But stress management is still important just for your own sanity and, for longevity. So that's one of my other tips, stress management through meditation, mindfulness, just trying to find some sort of an outlet so that you don't have that pent up stress over time. Another important piece of advice, and this would be number 4 for me, is getting really good sleep. We never talk about it enough, but sleep hygiene is incredibly important when it comes to your normal bodily functions, and your reproduction is no exception to that. And number 5, and arguably one of the most important things, is if you are struggling to conceive after a year of trying, 6 months if you're over the age of 35, then it's really time to go see a fertility specialist to try to get to the root of the problem and see what is going on. It doesn't always mean that you're going to need IVF just because you're seeing a fertility specialist, but figuring out the root of the problem can help you at least come up with a solution.
I love those tips. Amazing. And so just a couple of comments. I get this question a lot as well. Folate or folic acid? Should we be focused on one or the other? I know you said folic acid, but so what's your thoughts on that?
So that's a great question. I know that there's a lot of attention when it comes to MTHFR mutation and the ability to absorb folic acid. This remains incredibly controversial. The reality of MTHFR is that these mutations, or what we call polymorphisms, are present in about 40% of the population. And so if it was really that big of a deal, we would have seen it impacting a lot more people. The problem is with the research that's out there, and the reason why it's so controversial is because necessary in vitro studies to look at protein function in response to folate versus folic acid has not been performed. And this is really, really necessary in order for us to understand how specific mutations can affect protein function. So as it stands, I honestly tell my patients it doesn't matter. If you feel really strongly about folate, then take folate, that's fine. But folic acid is honestly just as good. And so if that is what's in your prenatal, that's perfectly fine as well.
I love it. I love it. And then to go back to plants, I also recommend a majority plant-based diet, but sometimes I'll have clients where their iron might get a little bit lower because they're not eating enough red meat. Do you find this? And what do you say to that?
I actually don't find this, and I always ask my patients what their diet looks like because I really like to look at the full picture. And what I've noticed is there are just some patients who are predisposed to having low iron. A lot of really heavy red meat eaters still have very low iron. I had been vegan for 4 years, and my hemoglobin's fantastic. My iron is great, and I do see a lot of plant-based patients who never touch any animal products, and their iron's great. So I think that it's just a genetic predisposition. And when you have low iron, that the solution is frankly just supplementation if you can't get it from your diet.
I love it. I love it. Well, tell us where we can find you. Where can we learn more about working with you?
You can learn more about me on my Instagram. If you follow my account, it is Sasha Hakman, MD. I also have a website with some of this information all laid out for you for free at sashahakman.com. I'm currently one of the physicians at Vitus Fertility in Detroit, Michigan.
I love it. Amazing. Well, before we close out, Dr. Sasha, it's been so fun having you. So thank you for being here. Tell us any final thoughts. Any words of encouragement or wisdom you want to leave us with?
If you're going through your fertility journey and you are feeling discouraged, just know that you are not alone. In fact, even as a fertility specialist, I have been through my journey. I know what you're going through. Just find your support system, someone that you can really trust to lean on, and find a team who will really help you in being successful in your journey and really, truly wants the best for you.
I love it. And I completely agree. So thank you for that. And thank you again for being here. It's so fun.
Thank you for having me. It's been a pleasure.
Yeah. And thank you, ladies, for listening to the Hormone P.U.Z.Z.L.E Podcast. Until next time. Bye. Hey, hang on just 1 second before you go. I want to make sure that you are aware of all of the amazing free resources that I have for you on my website at CoachKayla.com. From a fertility meal plan, a cycle syncing quick start guide, a holistic healing cookbook, as well as master classes, blog posts by me and some amazing experts in the fields of fertility, hormones, and nutrition. So many wonderful resources that will help you on your journey. And I wish there had been something like this when I was going through my 2 years of infertility, but there just wasn't. And so that's why I decided to create all of this for you. So make sure that you go and check it out and you take advantage of this plethora of support that I have provided for you. And spoiler alert, these were some of the same tricks and the same foods that I used to get myself pregnant, not once, but twice, even after my doctors said that I couldn't. So I know that these things work. Make sure you take advantage of that. And I cannot wait for you to be my next success story. So thanks, love. See you soon. Thanks for tuning in today to the Hormone Puzzle Podcast. Check out the show notes for today's episode at CoachKayla.com. If you like what you hear, please subscribe and leave a review. Thanks for hanging out with me, and I'll see you next week.